Good day everyone, I am Daniela Saneha, a first-year nursing student from Catanduanes State University. And for today's video, I am going to show, or the assessment that we were going to do is an ear assessment. So prior to performing the procedure, first I am going to sanitize my hand. After sanitizing, I am going to close doors or curtains to ensure the client's privacy. Alright, so after ensuring the client's privacy, I am going now to introduce myself to the client and check the client's identity to make sure that I have the correct patient in front of me. Good day, ma'am. I am Daniela Saneha, your student nurse for today. Ma'am, can you say your name and birthday, please?
Anastasia, November 23, 2002.
Alright. After checking the client's identity, I am going to explain to the client the procedure that we will going to do, why it is necessary, and how he or she can participate. Good day, ma'am. So, for today, I am going to assess your ears, ma'am. I am going to check the external and internal structure. Ma'am, is that okay with you?
Yes.
Alright. Ma'am, so do you have question before we begin? Okay, so let's begin to the procedure. The first thing that we want to inspect here would be the external ears structure of our client for any signs of redness, inflammation, or swelling. We also want to take note of the color and the symmetry of the ears. Alright, so as I was inspecting the ears, I do not see any swelling or discoloration, and the ears is symmetrical. So there is no abnormalities on the external structure. So now we are going to palpate the external ear going to the mastoid muscle. In this procedure, we are trying to assess any kinds of swelling and tenderness. Ma'am, do you feel in any pain, ma'am? Alright. It seems that there is no abnormalities, so it is good. So the next thing that we need to do is to inspect the internal area of the patient using an otoscope. So I have here an otoscope. By doing this, we are trying to look for any signs of ear infection or excessive earwax. Alright, so as I was inspecting, there is no excessive earwax. There is also no infection, so everything's normal in the internal structure of the ear of the client. The last thing that we need to do in the assessment of the ear would be the whisper test. So let us see. Mom, I am going to say a word and say what you hear. Black shirt.
Black shirt.
White shirt.
White shirt.
Alright, so the client hear what I whisper, so it seems everything is normal. So that ends the assessment of the ear. Good day everyone, I am Daniela Saneha, a first-year nursing student from Catanduanes State University, and for today's video, I am going to show you an assessment on the neck and ears. So prior to performing the procedure, I am going first to sanitize my hand. Alright, so after sanitizing, I am going to close the curtains and doors to ensure the client's privacy. ensuring the client's privacy, I am going now to introduce myself to the client and ask the client's identity to make sure I have a correct client in front of me. Good day, sir. I am Daniela Soneja, your student news for today. Can you state your name and birthday po?
I'm Jidal Rigon. I'm 19.
Alright, so after checking the identity of the patient, I am going now to explain to the client the procedure that we are going to do. Sir, for today's video, I am going to assess your neck. Is that okay with you, sir?
Yes.
Alright, so now let's proceed to the procedure.
Start by inspecting the neck from all angles, looking for scars, obvious lumps.
Sir, can you take a sip? Hold the water in your mouth, sir. Then
As the patient swallows, look for a thyroid mass, which will move on swallowing. As the patient sticks their tongue out, look for a thyroglossal cyst, which is a midline lump that will move upwards on tongue
Sir,
projection.
I am going to palpate your neck. Is it okay with you?
Next, palpate the neck from behind, having warned the patient what you're about to do. Palpate all 6 levels of lymph nodes in the neck. Start at level 1, which is the submental and submandibular lymph nodes, and also feel for the submandibular gland. Next, feel the level 2 lymph nodes, which are the upper jugular nodes. Then the level 3 lymph nodes of the middle third of the jugular.
Sir,
Feel for any thyroid masses, which will move on swallowing.
alright.
Thank you very much.